also explains why our young girls are getting their periods early, so they are quickly gaining the 40 kilograms and their body will start making this particular hormone, then they will get their menstruation. Hi, my name is Lucy. I'm a medical clinical officer and a health educator with Mukazi Wellness here on YouTube, Instagram, and on TikTok. In this video, we are going to talk about a type of hormonal imbalance that many of us women battle with, and it is called estrogen dominance. What is estrogen? Estrogen is that hormone that is responsible for us women to have the feminine properties and also for the menstrual cycle. So estrogen is responsible for things like breasts, hips, bums, a supple skin, and that's why we see that as we age, as we approach menopause, the skin loses its elasticity, it stops being so supple because this particular hormone is reducing in the body. So what is estrogen dominance? Estrogen, like all hormones in our bodies, work hand in hand. So estrogen works hand in hand with another hormone in the body that's also responsible for the menstrual cycle and pregnancy, and this particular hormone is called progesterone. So when amounts of estrogen, high amounts of estrogen increase in the body, we face this particular thing. But what causes these amounts of estrogen to increase? Number one, we should know that this particular hormone, estrogen, is made from fat, the body fat that we have in our bodies. That's why when we reach a particular body weight, 40 kilograms, the brain will signal the rest of the body and will start making this particular hormone. And this particularly also explains why our young girls are getting their periods early, so they are quickly gaining the 40 kilograms and their body will start making this particular hormone, then they will get their menstruation. So when we have excess body fat as women, it causes us to have a lot of estrogen produced in our body, and then we shall get the estrogen dominance. That is number one. Number two, another thing that could cause us to have a lot of estrogen in our bodies, it can be caused by the exposures, the things that we are exposed to. So there are things like pesticides, there are things like perfumes, there are things that are present in plastics, and these are things that we call xenoestrogens. So there are things that when we inhale or we take into our bodies, they will mimic the way real estrogen acts in our bodies. And when they mimic the way estrogen acts in our bodies, then it will have that excess. It will cause the body to have an excess of estrogen. So the other thing, you're confused. And now I've gone to causes. So another thing that causes our bodies to have an excess of estrogen, they are the hormonal changes as we approach menopause or perimenopause. So we realize that as many of us women, as we reach the age of around 40, we will start experiencing heavier periods, and they are quite unpredictable. Like you really don't know, you just see the period coming. You can't really tell when it's going to come, but it will just come upon you. So when you're getting those surprise periods, they are most times really heavy. So it's caused by the perimenopause, because as we approach menopause, the number of eggs we have in our body will reduce, and the regularity of the period also changes. So having known the things that cause this particular hormone to increase in our bodies, I would want us to also know the symptoms that we will experience if we are, like, let me say, the red flags for us to look out for, so that we can quickly go and seek medical attention. So the number one red flag they are heavy, prolonged periods. But now the tricky part about it is sometimes they could be missing periods. So at times they are heavy and prolonged. At times the period totally like disappears. You know you've not had sex with a person, you know you're not pregnant, but your period has disappeared. It could be a sign of estrogen dominance. Another sign that could be a sign of estrogen dominance is brain fog. Like you find yourself confused, you find it too hard to concentrate. It could be a sign. But also, there are signs that we experience pre-menstrual symptoms, the PMS. So if you are experiencing, you're getting highly irritable, you have terrible mood swings, you have huge levels of anxiety as your period comes, this could be like red flags for estrogen dominance. But also, another thing to consider as women, their tenderness of breasts. If your breasts are growing bigger and they are somehow painful, this is one thing that you should also like look out for. Because as women, our fat distribution in the body is distributed on the breasts, on the hips, and on the bum. So now we know that estrogen is made from fat. So when we see that this is something like that we are experiencing, you're getting, your breasts are getting bigger, your particular hips are also getting bigger. So, and it is ringing with your cycle, the periods are either missing or they are prolonged and heavy. Away from the breasts and the hips and the bum getting bigger, also like if you notice you're excessively gaining weight and it's unexplained, these are things you should look out for. So it's unexplained and you're not taking the hormonal contraceptives. So if you are also experiencing disturbances with your sleep patterns, you know, you wake up in the night, you have no sleep, and some of these signs are experienced during pregnancy or they're experienced when you have another medical condition. But when you know that these medical conditions are not there and you're experiencing these particular signs and symptoms, please seek out medical attention. And something to reassure you on, having symptoms does not mean that you have the particular thing. Sometimes they are just symptoms that have come because of just a slight change in the levels of this particular hormone. But there are times when the signs are alarming, because when we persistently continue to have high levels of estrogen, it leads us, women, to have the breast cancers, the uterine cancers, and these are things that take time to show, but they show up later when we have increased in age. So if you're having these particular symptoms, please seek medical attention. Another thing for you to be cautious on as you seek medical attention, these hormonal disturbances are only and only diagnosed on blood tests. So if you go to your healthcare provider and they are giving you a diagnosis without first checking your hormonal levels in the body, please be cautious about that. The good news is we can manage estrogen dominance. We can manage the high levels of dominance of estrogen in our bodies. How? Simple lifestyle changes can help us to manage these levels. So what do? First, we shall look at our diet. There are foods that can help us to reduce amounts of estrogen in the body. So if you're experiencing these symptoms and your healthcare provider has told you it's nothing to worry about, or you really are not yet ready to go to the healthcare provider, these are things you can do. If you notice a change, well and good. If you've not noticed a change, then you can proceed to your healthcare provider. So with diet, we shall focus on foods that help us to excrete excess estrogen. Which foods are these? There are carrots, there's broccoli, there's kale, there's cauliflower. So it's best to eat them when they are, the carrots when they are raw, and these other ones when they are not overly cooked, because when you overly cook them, they lose their nutrient values. Another thing that we should also focus on is exercising. When we exercise through the sweat, we remove the excess, we help the body to remove the excess estrogens. Another thing also we should also focus on, we should also mind our stress levels. So how do we mind the stress levels? Small things. You do things that you love, that help you to relax, that help you to calm your body, that help you to de-stress. It could be exercising, it could be going out with friends, it could be watching movies, it could be anything that you do that helps you to relieve stress. Because when we have high levels of stress, it releases certain hormones that favor this particular hormone to increase within the blood in our bodies. And lastly, another thing that we should take note of, that we should practice, we should reduce our exposure to these false estrogens, the xenoestrogens that we take in through plastics, through the self-care things that we use. There are things called parabens, there are certain ingredients. So if we can use particular things in moderation, like minimize the candles that you light around your home, the scented candles, minimize the amounts of perfume that you're using on your body, minimize the scents. If you are scenting your clothes at the laundry part, having the house scented, then you're using shower gels that are terribly scented, perfume, then body splash, then the car has air freshener. So let's minimize our exposure to these false estrogens that when we take into our bodies give us the side effects of estrogen dominance. That said, if any of the things that have been mentioned are a thing that you're experiencing, please seek medical attention. If you cannot afford to seek medical attention, practice the lifestyle changes. Otherwise, thank you for sticking around. See you next week. Bye.